Our next speaker is Tao Yu, also from the Department of Surgery, and I'm afraid you're going to have to introduce yourself as well.
Hi, good afternoon. Thank Dr. Krause for introduction. I'm Tao Yu, assistant professor in the Department of Surgery and also the immunology. I got my PhD degree at UT Southwestern in 2011. And many of the professors here actually were in the same program, my graduate program. Dr. Streck, Dr. Lin, and Dr. Lin actually is also my qualified exam member. Well, I passed, And after I got my PhD degree, I joined Dr. Bruce Butler's lab to study immunology. And we took the forward genetic screen approach to identify genes involved in T-cell mediated immunity. And in the past few years, I worked with Yang-Xin Fu to study cancer immunotherapy and develop the novel immunocytokines. So today, I will introduce my research program, which is focused on dissecting immunoregulation during the musculoskeletal regeneration and tumorigenesis. So trauma is the leading cause of the death for the people age from the 1-year-old to the 46 years old. So among non-fatal traumatic injuries, over 40% of the patients have the more than one musculoskeletal injuries. And in the past, we can see clearly here. So each year we have like more than 240 patients suffering these musculoskeletal injuries, and also cost more than $4 trillion in the United States alone. The improvements in the trauma care has dramatically increased the patient's survival. However, this also led to post-injury complications, such as heterotopic ossification that I'm going to introduce to you. So heterotopic ossification, HO, defined as the formation of the ectopic bone in the muscle and other soft tissues, is a failed tissue regeneration. And so it occurs in the high incidence with patients suffering the combat injuries and major burns, traumatic brain and spinal cord injuries, and even hip replacement. So the HO causes the chronic pain and impaired wound recovery and reduce the quality of the life. Despite the current treatment, still 70% of patients suffer from the persistent pain and joint stiffness. So pathological inflammation mediated by the macrophages is a key niche factor for the HO formation. HO, as shown here, is a multi-stage pathological process. After the initial insult, such as the trauma and the surgery, the macrophage infiltrated into these damaged tissues and cleared the cellular debris and pathogens, and also produce growth factors and cytokines to promote tissue regeneration. However, misregulated macrophages can apparently differentiate these mesenchymal stem cells into the osteogenic lineages, promoting the ectopic bone formation. So, we actually take this burn anatomy model to study this complex multi-stage process. So to create this model, we first created the 30% total surface burn in the back of the mice, and we also performed the tenotomy. Basically, it's the division of the Achilles tendons to introduce this heterotopic ossification formation, as shown here. Yeah, as shown here, this is the ectopic bone formed at the injury sites. So to identify the critical regulators, particularly epigenetic regulators during this HO formation, so we performed the single-cell RNA sequencing approach. So we first isolate the tissues from the injury sites and also from the bone marrow and also the blood using these burn anatomy mouse models. And the single cell RNA sequencing particularly identify the multiple cell clusters, and we look at the expression of the human conserved epigenetic modified expression. So in the injury macrophages and also in the macrophages isolated from the marrow and also blood. Clearly, on the top list, we found one histone demethylase named GMGD3 is upregulated during the HO formation, and the level remains high at the later stage of the HO progression. So the GMGD3, as I said, is a histone demethylase, removes the repressive H3 K27 trimethylation groups. So our following studies by using the genetics and the immunological approaches and also the pharmacological approaches, we found the GMGD3 actually promotes the pro-inflammation and pathological inflammation in the injury site, and also upregulates the HO promoting factors such as TGF-beta expression, so and promotes the HO formation. So now we are actually using the GMGD3 inhibitors, GSK-G4, to treat this burnt anatomy mouse model and to see its therapeutic benefit. So furthermore, our group also conducting comprehensive multi-omic analysis, including the spatial transcriptomic sequencing, proteomics, and the metabolomics, and as well as single-cell attack sequencing, chip sequencing, to identify the crucial molecular mechanisms involved in the tissue regeneration, such as the HO formation and also muscle regeneration. So here we actually, through the spatial transcriptomics analysis, we identified the progenitor cells is responsible for the HO formation. So through this multi-omic analysis and the integration analysis, we aim to identify the biomarkers during this musculoskeletal regeneration and also the drug targets, so relevant to the precision medicines. In the next few slides, please let me just change the gear, talk about the another research direction in my group, which is targeting acidic immunosuppressive tumor microenvironment for cancer immunotherapy. So acidic metabolic byproducts accumulated in the tumor tissues, as many of us know, during the high metabolic rate and also poor perfusion. So it's important to know this acidic tumor microenvironment is emerging as another immunosuppressor mechanisms, as we found the tumor acidification can drive the dysfunction of the cytokines, crucial for T-cell mediated anti-tumor response. Here we show you example is the interaction between the interleukin-2 and its receptor is altered in this lower pH from the tumor microenvironment. Here we can specifically at a pH 6.4 indicated here. So the interaction between the interleukin-2 and its receptor is greatly diminished compared to the neutral pH. So Given the interleukin-2 has reduced the binding and the activity in the lower pH, we performed the directed evolution to identify interleukin-2 mutants, showing the increased binding affinity to its receptor at the lower pH. So we generated a human interleukin-2 mutant library and displayed this library on the yeast surface and performed the screen, identify the novel acid-resistant interleukin-2 variants. Here is what we found. We found that the novel interleukin-2 variants can significantly increase its binding at a lower pH, as well as higher activity to induce interferon gamma production from the CD8 T cells at low pH. So to further explore the therapeutic benefits of these interleukin-2 variants, we fused this interleukin-2 variants with the immune checkpoint inhibitors, such as what we know like PD-1, PD-L1, and others such as the innate immune checkpoint inhibitor, CYP alpha. So to create the immunocytokines to treat the tumors, we tried several different cancer models, including osteosarcoma, kidney cancers. Here we use the osteosarcoma as an example because osteosarcoma not only producing the lactic acid, but also actually can induce the hydrochloric acid production. As the osteosarcoma progression, it has to promote the bone reabsorption. So this hydrochloric acid will further lower pH. We feel this is a very good model to look at this acidic tumor suppressor, immunosuppressive microenvironment. So our preliminary data indicates the osteosarcoma in mouse models response the immunocytokines pretty well. So now our following study will combine the STING agonist nanoparticles with immunocytokines to further boost the immune response in these tumor mouse models. As we know, the immunotherapy has revolutionized the cancer therapy. However, still considering a number of the patients not responding to the immunotherapy, and also developers are resistant to the immunotherapy. To identify the critical signaling pathways exhibiting the synthetic lethality with the immunotherapy, particularly in our case, in the immunocytokines treatment, we are performing the genome-wide and also metabolic CRISPR screen in vivo and also in vitro to identify the critical drug targets to further improve the cancer immunotherapies. So I will stop here. I want to thank the members in the lab and also want to thank the Center for Oncogenesis Research in Trauma support, and also my mentors and my grant support. Thank you for your attention.
All right, great. Any questions?
And you also using that mutant interleukin-2 to apply that in other cytokines to improve basically in the cytokine effects at low acid environment.
Yeah, definitely. Yeah, here we just use interleukin-2 as an example. We actually also look at other cytokines such as interleukin-12, interleukin-15. People actually use this actually to combine with other antibodies for the improved immunotherapies. On the other hand, we also can use this approach to identify the actually low affinity cytokines. For example, a lot of low affinity cytokines are also like cytokine antagonists that have been used for treatment of the autoimmune disease. Yeah, that's the platform we are trying to establish.
So just a quick question in the beginning part of your talk with this interesting identification of it's JMJD3, right? Do you have any idea of how, I mean, I guess that was what you showed was a transcriptional response, right? You have any idea of how it gets upregulated so strikingly?
Yeah, that we are very surprised as well to see such a greater upregulation. As some study indicates, the GMGD3 is upregulated by the tolerant receptor 4, which is the topic group that started for many years.
Yeah.
So we find actually we did some biochemical analysis. We found actually indeed at the injury side, the upregulated PL4 signal is responsible for such a great upregulation of the GMP3
Yeah, great.
in macrophages.
All right, why don't we go ahead and thank Tao for a great talk.